You're likely looking for ways to help your child with autism spectrum disorder, ASD, and you may have heard about alternative treatments and interventions. While there is no one-size-fits-all answer, it's important to explore all of your options and find the best treatment plan for your child. There are many alternative treatments and interventions available, and it can be overwhelming to try to figure out what's best for your child. In this video, we'll discuss some of the most common treatments and interventions, as well as the pros and cons of each. We hope this information will help you make the best decision for your child. What is autism? Autism spectrum disorder is a neurodevelopmental disorder that affects communication and social interaction. It also affects the way a person perceives and interacts with the world. In some cases, people with autism might have exceptional abilities in specific areas, such as music or math. But while autism might look different in every person, it can be a challenge for the child and the family. There is no one-size-fits-all answer to autism, but there are treatments and interventions that can help your child. Alternative treatments and interventions might be something to consider if your child doesn't respond to traditional therapies. What are the causes of autism? There is no one answer to this question because autism is a complex disorder that affects people in different ways. But scientists believe that it's caused by a combination of genetic and environmental factors. Some of the most common causes of autism include exposure to toxins like mercury and lead, premature birth or low birth weight, mitochondrial disorders, genetic disorders like Fragile X syndrome or tuberous sclerosis. There is still a lot we don't know about autism, but researchers are working hard to better understand its causes. In the meantime, there are a number of alternative treatments and interventions available that can help your child improve their quality of life. How is autism diagnosed? So how do doctors diagnose autism? It's a process that takes time and involves observing the child's behavior and development. There isn't one single test that can diagnose autism, and it's important to rule out other conditions, like ADHD, that might have similar symptoms. The doctors will ask questions about the child's early development, and they'll also look at the child's language skills, social interactions, and creative play. Sometimes they'll use tools like an Autism Spectrum Disorder Questionnaire or the Autism Diagnostic Observation Schedule, ADOS. It's a long process, but it's important to make sure that the diagnosis is accurate. Once autism is diagnosed, then you can start to look for appropriate treatments and interventions. What are the symptoms of autism? So, what are the symptoms of autism? Each child experiences it a little differently, but some common symptoms include difficulty with communication and social interactions, obsessive interests in specific topics or activities, and sensory sensitivities. If you're worried that your child might have autism, it's important to get them evaluated by a professional. There's no one-size-fits-all answer when it comes to treatment, but there are a number of alternative treatments and interventions that can help. Some parents choose to go with a gluten-free/casein-free diet, while others might try therapies like behavioral or occupational therapy. There are also a number of supplements and medications that can be helpful. The key is to find what works best for your child and to start treatment as early as possible. What are the conventional treatments for autism? So, what are the conventional treatments for autism? The good news is that there are a lot of different approaches that can help kids with autism spectrum disorder, ASD. But the bad news is that there's no one-size-fits-all answer, and what works for one child might not work for another. That said, some of the most common treatments involve medication, behavioral therapies, and educational interventions. Let's take a closer look at each of these. What are some alternative treatments and interventions for autism? So, you're exploring autism treatments and interventions. That's a great step in the right direction. There are a lot of options out there, and it can be tough to decide which ones are right for your child. But we're here to help. One popular treatment is called ABA, or Applied Behavior Analysis. This approach uses positive reinforcement to help your child learn new skills. Another option is called speech and language therapy. This therapy helps children with autism learn to communicate better. If you're looking for an alternative to medication, there are a number of herbal remedies that have been shown to be helpful in treating autism symptoms. Some people have also had success with gluten-free and casein-free diets. Whatever route you decide to go, remember that the most important thing is that you find what works best for your child. There is no one-size-fits-all solution when it comes to autism treatments and interventions. Talk to your doctor and your child's educator to get started on the path that's right for your family. How can you choose the right treatment or intervention for your child with autism? It can be overwhelming trying to decide which autism alternative treatment or intervention is right for your child. After all, you want to make sure you're choosing the best possible option for them. Here are a few things to keep in mind as you make your decision. First, it's important to talk to your pediatrician about the different treatments and interventions available. They can help you narrow down your options and recommend the best course of action. Second, it's important to take your child's personality into account. Not all treatments and interventions are going to be a good fit for them. Third, research the different treatments and interventions available before making a decision. This will help you make an informed choice about what's best for your child. Finally, don't be afraid to ask for help from experts or other parents who have gone through the same thing. They can offer invaluable advice and support as you make this difficult decision. Are there any side effects to alternative treatments and interventions for autism? So, you're considering alternative treatments and interventions for your child with autism. That's great. But you're probably wondering if there are any potential side effects. The good news is that most alternative treatments and interventions are very safe. However, it's always important to talk to your doctor before starting any new treatment. Some of the more common side effects include changes in behavior, increased energy, and improvement in communication skills. But again, it's important to consult with your doctor to see if a particular treatment is right for your child. How can you find a qualified provider of alternative treatments and interventions for autism? So, you're considering alternative treatments or interventions for your child's autism. That's a great decision, and you're on the right track to finding the help they need. But now you might be wondering, how can you find a qualified provider? First, ask around. Talk to your friends, family, and other parents who have autistic children. See who they've worked with and what they thought of their experience. Second, do your research. Look for providers who have experience in treating autism and who are licensed or certified in their field. Make sure to read reviews and compare prices before making a decision. Finally, don't be afraid to ask questions. The best providers will be happy to answer all of your questions and will be more than happy to provide references. So don't hesitate to reach out and get started on finding the right treatment for your child. So, you've been told your child has autism. It can be a scary and confusing time, but don't worry, there is hope. Autism alternative treatments and interventions can help your child reach their fullest potential. There are many different treatments and interventions available, so it's important to find the right one for your child. Talk to your doctor about your options, and read up on different treatments to see what might work best for your child. Autism alternative treatments, autism interventions, help for autistic children.